Welcome to a new interview. I'm Simone Parisi from Italy. I'm actually the co-lead of EMEUNET social media subgroup. And today we are here with Christelle Awad because her abstract won the Top American College of Rheumatology Abstract 2020 contest. Hello, Christelle, and welcome.
Hello, Simone, and thank you for the introduction. Actually, I'm a rheumatologist from Lebanon, and I did my training in Pitié-Salpêtrière Hospital in France with an amazing team. And I'm actually doing now my master's degree with Professor Laure Gossec in Paris. And actually, I'm here on behalf of my team in Pitié-Salpêtrière Hospital in France. And I would like to say that we were really very proud to win this year the best ACR abstract from EMEUNET. So thank you again for inviting me to talk about our research project. So actually, I worked on this project with Professor Laure Gossec, who was leading this project, and with the head of department, Professor Bruno Fautrel, and two rheumatology fellows, Georgia Moisidou from Greece and Ansa Rakoto from Madagascar. So actually, we were an international team reunited in Paris at that time, and we worked all together on this very interesting topic.
Congratulations, a really international team.
Yeah.
Congratulations on the victory with more than 100 votes, a great result. So let's get into the specific now. And first of all, what we already know about this activity evaluation in psoriatic arthritis?
Well, actually, in psoriatic arthritis, it's a very heterogeneous disease. So there are many outcome measures that can be used in psoriatic arthritis. Some are specific to PSA, such as minimal disease activity. Some others that are generic, such as patient assessment of pain. And some are borrowed from rheumatoid arthritis, for example, such as DAS28. So actually, what are the optimal instruments to measure disease activity in PSA? So actually, there is not yet a clear consensus on which outcome measure is the best to use to evaluate the different manifestations of the disease. And we know from a previously literature review that in trials published before 2012, there was also a lack of uniformity in PSA evaluation of the disease activity. So recently, the core set of domains to be assessed in all randomized controlled trials and longitudinal observational studies was updated by the GRAPPA-OMER Act in 2016. So there was 8 inner core domain sets that are recommended to be assessed systematically in every randomized controlled trial and every observational trial and studies. And they include actually musculoskeletal disease activity that comprises actually peripheral joints, dactylitis, enthesitis, and axial involvement, and also skin disease activity, systemic inflammation, and 5 patient-reported outcomes that are pain, patient global assessment, physical function, fatigue, and health-related quality of life. And the other several domains that are proposed in the core set and that are important, but not mandatory to assess. So, although the core set have listed domains to be assessed in psoriatic arthritis, there is currently no real consensus on the best outcome measure to assess each domain. So this is why we thought that registries may provide important insights into the outcomes collected in PSA, and it may provide also a photograph of the current clinical practices.
Thank you very much. So what is the objective of your study, and what really does your study have?
So actually, the objective of our study was to assess outcome measures collected in recent PSA registries or longitudinal cohorts through a systematic literature review. So what we did is that we reviewed all the publications between 2010 and March 2020 in Medline PubMed database. And of course, our protocol was also registered on Prospero. And we found initially 673 abstracts. And then we were 3 persons to select the relevant papers on titles and abstract, and then on full text. And after this selection strategy, we finally found 73 papers that related and reported on 27 PSA registries and cohorts. So actually, let's go to our main results. So overall, 58 different clinical outcome measures were collected. So only by looking at this number, you can see how many different outcome measures were used to evaluate the same disease. So the first message is that we found that almost all the registries reported joint involvement and skin psoriasis. So for the joint involvement, the most frequently used outcome was the 66 and 68 joint count. And actually it was recently recommended by the OMERACT in 2018 as the optimal instrument to measure peripheral arthritis. So this indicates that there was actually an agreement between practice and the recommendations. So on the other hand, enthesitis, dactylitis, and axial involvement, actually they were less frequently reported. So this reflects that actually the evaluation of enthesitis and dactylitis in PSA is still unclear. As for the spine involvement, there is this emerging entity of axial psoriatic arthritis that seem to be a bit different from ankylosing spondylitis with psoriasis. So I think spinal involvement, even if it was not very frequently collected in registries and cohort, it is really important, an important aspect to assess in patients with PSA. So now, for the patient-reported outcomes, we found that the most frequently reported ones were the HAC, the pain, the patient global assessment. And for the fatigue, it was reported in 33% of registries. So you may think that 33 is not a very high percentage, but actually in 2012, when the systematic literature review was done on trials, only 15% of the articles reported fatigue. So now I think it is increasingly being reported in the registries and cohort, because actually it's an important topic, and mainly because it has a high impact on the quality of life of the patients. And also it's part now of the inner corset domain. So of course, more data are awaited in PSA for fatigue. So my second message is that the composite disease activity measures, actually they were frequently reported in 74% of the registries, and there were a great diversity of the composite scores used. So the most used one were the MDA, but also the BASDAI, the DAS28, DAPSA, and the other scores, composite score, were rarely reported in the registry that we found. So in fact, MDA and DAPSA are the two recommended instruments to define treatment target, and this was recommended by the International Task Force in 2017. However, on the other part, the DAS28, it's adapted mostly for RA, and it is not recommended to evaluate disease activity and in PSA. So overall, our study puts a light to an important heterogeneity in the assessment of disease activity in psoriatic arthritis. So we found that peripheral joints and skin involvement were the only domain which were almost systematically assessed. And this probably indicates that at least on these domains, there is consensus on the scores to use.
Really very interesting, your points, but let's talk about the future perspectives. How might this study impact our clinical practice or future development?
Well, our study showed that outcome measures reported in PSA and in PSA registries and cohort are very heterogeneous. So this reflects that there is a lack of international consensus. So we found that only 11 registries collected all the 2006 core domain set, and only 2 registries reported all the 2016 updated core domain set. However, we have noticed that in the last decades, actually there was an increasing number of PSA-specific registries and cohorts that have emerged. So we found that 15 of the 27 PSA registry were initiated after 2007. So researchers now are even more interested to report outcome measures in PSA, and it would be interesting to look again in a few years also to see what we will find. And in the meantime, I think that more work and consensus initiatives are really needed on outcome measures in PSA to allow a better standardization in the future.
Thank you very much, really, and especially for your crystal clear presentation, explanation, and thank you another time for participating and being with us, and another time congratulations for your fabulous victory.
And I would like also to thank again EMEUNET for inviting me to talk about this very interesting topic. And hopefully you will be able even to read in more details when the full paper will be published. And I would like also to thank my team and my colleagues for all their efforts and their dedication to make this research project happen. And especially I would like to thank Professor Laure Gossec for her amazing leadership and her investment to the success of this project. And also, of course, Professor Bruno Fautrel for his support during my training in his department. Thank you.
Thank you very much. Bye-bye. And for all, if you want to stay up to date, don't forget to follow us on our social channel. Bye-bye.
Bye. Thank you.